All right. This is Tracy Schroyer, and I am doing a series of videos to share with you my breast cancer journey from the time that I scheduled that mammogram through my current day experience, as well as continuing to share information with you. And the first couple videos, I've done two already. The first one, I talked about scheduling the mammogram, having that, the ultrasound, and the biopsy. The second video, I got into getting the news, getting into my MRI, and then this video, I wanted to share with you about the very first visit I had with my breast surgeon, and what the options were to kind of move forward and what that all looked like. This is the last video that I'm going to record for the time being. So the next video after this may be a couple days from now or in another day or two um, to talk about my journey and to continue going on. So for this one, I want to talk about my breast surgeon visit. So just to backtrack, I got the news on January 2nd that the biopsy that was done on New Year's Eve was cancer. They were only telling me whether it's cancer or not. They were doing additional testing on the cells that they took from the biopsy to figure out additional information on what the grade was, what the stage was, what was feeding it, and all these different things to help the breast surgeon to determine what the course of treatment could be, what my options were. So I went into the breast surgeon, did not really know a lot about what I was walking into. But I went in there and she did not examine me. And that felt like the first time I went into an appointment, and I didn't have to show off my bazungas. But I sat in there, and my husband was in there with me, and she came in with a nurse. And the nurse was typing in some things and looking up things, and she was going to talk to me after the doctor did. And the doctor basically told me, so we got the results back from the biopsy, the extended results, and they do certain grades. I had grade 2, it's 1 through 3. So 2 is kind of middle ground, they can't tell bad or not so bad. It's kind of a weird indicator, but I think it may tell the doctor a lot more than I took from it, of course. And she said I was stage 1B at that point. So it wasn't just in the milk duct area of my breast, but it had started to go into the tissue within my breast. So it had started to travel into the tissue of my breast. And from what they knew, when they had done the ultrasound, that it did not seem like my lymph nodes were enlarged or swollen or anything like that. That would indicate that it had gone further. So they had graded it, or the stage at that point was considered stage 1B. So very, very early in the process, which I was not surprised how early it was, because I remember I had just seen my gynecologist for my annual exam in June, and he had not found anything from the exam that he had done at that time. So that made sense. I remember her asking me if I had found it or the mammogram did. And I did tell her, I said, the mammogram actually found it, but once I learned where it was, I could feel it. I could feel the lump. And I mentioned on some of my earlier videos, it's more the tumor and mass was on the outer side of my breast versus like back in my chest wall. So I could it was really weird to be able to feel it, and very, very, very scary. And I did talk to a friend just a couple weekends ago, and her and I were talking about, you hear all these things to do a self-exam and to get examined, but they don't tell you what's normal, what's not normal. And they might say if you feel anything abnormal, but then you're worrying if you're making a mountain out of a molehill. But you know what? We both said if you feel like you have anything that's weird or doesn't feel right, get in and see a doctor and have them check it out and get another opinion. Um, and it's definitely worth it, and it could save a life. So my breast surgeon had told me, based on the results of that, one other thing that she told me, and they actually gave me a sheet with all this information on it, because your mind's like a zillion miles a minute, not knowing what the next few months or years of your life might look like. So on the sheet, it also talked about what was feeding the tumor, and So there's 3 different areas. There's 2 different kinds of hormones that they talk about. I can't remember what they're called exactly right now. And then there's HER2. So I was, for the 2 hormones, I was positive, and then for the HER2, I was negative. Um, I've heard of people being triple negative, and when you're triple negative, your cancer can be extremely aggressive. So sometimes people who are triple negative, I've heard, have gone into chemo first to try to minimize the size of the mass or the tumors, whatever you have, before you would go into surgery to try to take those out, whether it's lumpectomy or mastectomy, however that works. So I was HER2 negative, but the hormone receptors I was positive on. So one of the things that that meant was she told me that I needed to get in touch with my gynecologist because I would no longer be allowed to take birth control, because the hormones from that, even though it may be small, it would be feeding that cancer as well as any other kind of cancer in my body. So I cannot really have any kind of hormones. So, and I'll talk about that in a moment. But other than that, she had said, so my options, and she was very matter of fact, these are the options that you have. Once you're ready, this is what we do, all of that kind of stuff. So she said, your first option is you get a lumpectomy. And a lumpectomy, for those who don't know, is where they go in and do surgery and they take out, so mine was on the outer end. They would go out and take that chunk and make sure that they have good, they call them margins around it, that are non-cancerous, so that they're sure that they get it. And then from there, you may have a plastic surgeon like reshape your breast or do something with your skin. There's a lot of different opportunities for the plastic surgeon to work from there to make it as much as you look whole as possible. So that was an option. If you did a lumpectomy, you would have to do radiation afterwards. That really freaked me out. I know a lot of people have an easy time, are good with it. There was just something about it, and hearing some stories that I was really uneasy about going that route. So there is the lumpectomy. Another option was doing a single mastectomy. So just taking that one breast, they take all the breast tissue out. And then they would check the lymph nodes just to make sure there was nothing that had started to travel. That can be difficult because you could either do a lumpectomy, stay flat on that side, and end up doing like in your bra, wearing a prosthetic or whatnot, to have your shape be normal or look as normal as possible. Or you could do a single mastectomy and get reconstruction from a plastic surgeon. And there's a couple different options there as well. Some can do a direct implant. A lot of it depends on what goes on in the surgery as far as the breast surgeon is doing, and then also how much skin is left, or how big, if you're going bigger, you're going smaller, that kind of thing. So those are options. The other option is to do a bilateral mastectomy or a double mastectomy, and that's basically taking all of the breast tissue from both of your breasts out, and from there either staying flat or having a reconstruction with a plastic surgeon, and he can put in, if you can go direct to implants, and there's a lot of dependencies on that, or you can get what they call tissue expanders. Now, I had heard about tissue expanders probably 10 years or more ago. I had a friend who was in my MBA program that had gone through it, and I remember her talking about that process that she went through. And then I also have a cousin that has gone through and talked about that as well. So I knew a little bit about that. Wasn't sure how far advanced things have come in the last 10 plus years or so. So I was a little scared of that, how much that would hurt. But I was also afraid of, I mentioned that radiation with the lumpectomy, and then the lumpectomy, how things would look and, be uneven, or, just look like you're mangled and that kind of thing. So a lot of different decisions to make and think through. And the scariest thing was probably that um, when I talked to the breast surgeon, is it's totally my decision at that point because of things laid out how they were for my case. So it was kind of like, you know what, we can have you, if you want to talk to a plastic surgeon. At the time, what I was looking to do was actually do a what was I gonna do? I was gonna do a lumpectomy and have breast reduction at the same time, and then I would have to go through the radiation. So in my mind, at that appointment on that date, that was where I thought I might be headed. Scared to death of, all of that, but that was my thought, and that seemed like um, kind of the easiest route to recovery and all of that. But then she talked to me. She gave me those. She said, I want you to talk to a plastic surgeon and see if you like him. If you do, talk about all of the options. Don't just talk about the one that you're thinking about today, but hear everything. So you have that all out on the table. And then once you decide if you do like that plastic surgeon and you do have a decision how you want to go, call our office and then we will work with the plastic surgeon to get a surgery date and to move forward and get everything ready. So I left that appointment thinking, when I walked out of there, that it was the lumpectomy, the reduction, and then I didn't like it, but doing the radiation. But when I got to the plastic surgeon and I talked with him, that my mind changed quite a bit. Just thinking about it, reading about it, talking about experiences with other people, and things like that. So my mind had definitely changed, especially when I walked out of the plastic surgeon's office and decided, how I wanted to move forward. So I will share that on the next video that I do. I won't get to it right away, probably in the next few days or so, but just share with you what happened during my plastic surgeon appointment and kind of where I went from there. So thank you everyone for listening. I appreciate it, and I hope you have a wonderful day.